Dr. Tomas Sandor. Dr. Sandor has experience in Caribbean health systems in Trinidad and Tobago, where he worked as National IT Director for the Ministry of Health. There, he supported the ICT unit and the minister in the development of the health information system, including the National Insurance System and the eHealth card initiative. He also worked in the British Virgin Islands and Belize as consultant for the University of the West Indies and the International Development Bank. He has lectured in medical informatics in the Masters in Health Administration course at the University of Trinidad and Tobago. He has also worked with UNAIDS doing an information technology assessment and recommendation of the information technology infrastructure for the public health sector of the Caribbean region, including Trinidad and Tobago, Grenada, Dominican Republic, and St. Vincent. He has also published the research paper, eHealth for Latin America and the Caribbean. So we welcome Dr. Sandor at this time for his presentation. Thank you.
Hello. Good morning, everybody. I will try to add some additional information. I was very keen with the presentation of Dr. Doane. He was very specific in terms of defining what are the needs of the region. And when we talk to the region, basically we are referring to the Caribbean, but also a number of Latin American countries are also involved in the same type of process. So, let me go to the next slide. So, I would like to define eHealth. Because eHealth is a very broad statement that involves a number of things. But in this case, in this particular presentation of mine, I would like to emphasize the area where eHealth is dealing with the health business. Now, a lot of people will react when I say we have to deal with the health business because they say, well, health is a public requirement, it's not a business. But basically, health is generally funded by important part of the national budget. We have to pay doctors, we have to pay infrastructure, we have to pay drugs, so there's a lot of money involved, and we have to run that business efficiently. And everything written around, in general, the business schools apply to the health sector too. So, in the first bullet, I said that healthcare is one of the most complex businesses to run, and really that is true. It's extremely complex to be run as a business. And I would say that the main role of health administration is to manage efficiently the funds that have been assigned. The concept of value for money is absolutely necessary. So I would like to apply this time the very broad meaning of eHealth into managing the health business. So in the second bullet, I say the economic activity must be closely managed, in particular the productive units like hospitals, health centers, labs, and we have to manage it properly. So, as I said in the first bullet, the funds that have been assigned to the health administration must be properly utilized. And in the third bullet, I said that all developed countries have large investments in ICT of health. And developed countries, they know the benefits of the ICT. ICT means information and communication technology. And if we look at the rates of investment in health, of ICT in health, from different countries, we will see that all the 41 countries that are called developed countries, specifically, they have invested in the last 3 or 4 decades a lot in information technology for health, and not the developing countries, which they lack that type of level of investment. So in the other bullet that says it is not the case of developing countries with low investments in ICT for health. And Kofi Annan, the former UN Secretary, said in one of his most relevant speeches that poor countries, just because they are poor, cannot afford not to invest in ICT for health. So again, I'm trying to emphasize the use of eHealth, in particularly as an important tool to manage the health business. So we all know that the health sector has been unfinanced for the last 3 or 4 decades. And we all know that there's rising cost of health due to aging population. The health awareness means that people are every year more conscious of their health stock, and they want to keep it up, so they spend more on health. So there's larger health consumption, and of course, cost of technology is rising because we keep adding technology into our health sector. So, health administration has to invest in that. But the budgets in general are similar. So how can we cope with these financing problem? So the only way to improve the health financing is to control expenditures. We have to control costs. We have to control fraud and abuse. That sometimes on these systems you got a lot of fraud and abuse. We have to improve efficiency, and we have to assign resources properly. So there's no other way, and this is what I believe lack most of the developing countries in the Caribbean sector. We don't manage properly health. So health is a lot of budget assigned to health, but we have to improve that administration of those funds. I'm talking about public or private. In generally the Caribbean sector, most of the countries have large public sectors that they take 70–80% of the health budget. So, but also it applies to those countries where the private sector is also large. Being public or private doesn't refrain you as an administrator to properly manage those funds. So, in general, what I found in the health system in the Caribbean, that those central needs of health, and this is something that Doane, David Doane have done it properly in his presentation, that they are fully staffed in managerial roles. Most of the central ministries are dedicated to extinguishing fires. There's always some problem have to deal with. They have quite difficulties in setting national guidelines for public health providers, and in general they have poor understanding on how ICT will help. So why I would have to invest so much in these technology? So they don't have the feeling of how they would help. So on the other hand, the public healthcare providers, they have personalized management with poor managerial experience, run by very enthusiastic and hardworking individuals. They put a lot of energy, but they have to solve inside problems with no wider national view. So they always type with local problems, and they don't have that general view as national views. So now what happened with the multinational financial institutions? There was a lot of money invested in Caribbean countries from the World Bank, the International Developing Bank, and these financial institutions that they give loans to the countries, but those loans are mainly used to build physical infrastructure. That is the easiest way of getting loans. Just set up a new hospital, spend money building hospitals, but it's not used to manage more efficiently their health business or their health resources or the health administration. There's very little money assigned to implement that. And it's not properly used to train human resources. In general, when I experience those funds to train human resources, they are very light and not really, these international financial institutions, they don't want to get involved in local administration. So what happens that the local administration decisions on how the loan money is used are generally faulty. In general, those monies that really are flowing down some of the countries are not properly utilized. So what I say that central ministries must be structurally supported. The healthcare business must be properly run with ICT tools in an eHealth platform. So again, I want to start digging into these concepts that the healthcare business can be run properly in the eHealth platform. So then you make a little distinction here. There are two main areas of the health administration. I would call individual health. When we deal with individual health, is that the health that is being the health provision that's been done in the hospitals, in the health centers, and they deal with individuals. And then we have the population health, that is the health, the concept of general population health that has another dimension of requirements, and that is the administrations of the national public or private health administrations. They deal with the population health. So from a standpoint of a centralized Minister of Health, they don't have to get involved in the understanding of what each individual health is being, how is it managed. That responsibility is placed into the health facilities. And now a central administration must deal with population health. So how how efficiently we assign the resources, how the statistics, and how the surveillance systems, and how efficiently we create, we manage those health systems and health plans, and we will dig a little more in this area. So basically, I would say that the eHealth administrations that I'm supporting are what I'm referring to is basically oriented to manage the population health, and that's where the major money is, and that's where the major difference is between developed and developing countries. And most of the developed countries, they have solved their health administration for the last 3 decades. Probably in the 70s or 80s, the main developed countries, they implemented information systems with their older technology, whatever. There was no internet and there was no eHealth, but they started to manage the health administration, and they generally know the the developed countries have a reasonably good understanding of how to manage the health. They know what the health costs are. They know the productivity of each provider. They know a number of things. So for the developed countries, the present state of development is based on the individual health. So for a developed country, a eHealth project is basically oriented to improve the individual health of their patients. So there's a lot of emphasis in developing tools with the information systems in order to improve the understanding and the knowledge of the individual health. That is basically electronic health records and mobile health and all these facilities that create or improve the individual health. But remember that developed countries, which on the other way, they write 95% of the documentation and of the the developments are performed by those developed countries. Their main objective is the individual health. Now, if we go back and look at the countries of the Caribbean area, or the Latin America area, which are not developed countries, we will see that they have very poor investment in health administration. They don't know cost, they don't know performance, they don't manage properly the resources. And so I would say that in developed countries, priorities are different. The priorities don't rely so much on the individual health. But first of all, they have to understand and they have to implement technologies to be able to run effectively the health business, because there's a lot of money being wasted in poor administrations, and if we don't manage properly, we will still waste money, and then the individual health, or the health of individuals, will be always hampered by the lack of administration. So I would say the objective of this presentation is to change a little bit the focus and orient the focus into the Caribbean area to be able to manage properly their public or the population health. All right. So I would say in these second bullet of this slide that through a technology-driven process, a national set of standards and business rules framework can be implemented. And a lot of these have been presented by Dr. Doane in his presentation. Information flow of meaningful data will facilitate the national health systems or the decision makers and define value for money. If we don't have information flow, an efficient information flow from the health providers into the health administrations, we won't be able to manage the health. The healthcare cost containment process can be initiated. If we have information, we can start looking how to contain cost or how to improve efficiency. The economic of scale in the Caribbean may require international cooperation between the area and information system with, I would say, and this is something that will develop now in the next few minutes, I would say that the online transaction or switching experience has been very effective in some of these Latin American areas, and that probably, I will try to explain in a few minutes. This has to be outsourced. I mean, there's some technology that could be very easily implemented and outsourced, and that I think is my recommendations on these specific webinar. So, what I call the eHealth solution would be a web-based centralized ICT platform with internet connectivity with all sides. This is something that is very easily in this decade to obtain connectivity is not a barrier any longer. So slight connectivity is very easy to be obtained anywhere. And through these eHealth solutions, we can become more efficiently or cost-effective by controlling healthcare provider service performance, reduce fraud and abuse. We can engineer plans, health plans for different beneficiary profiles. We'll see what a health plan is, and we will look for social financing opportunities and obtain some payment from those who can afford to pay. What I state is that eHealth solution, compared to other technologies, demands a minimum set of human and technical resources. So what information must be collected to be able to run the healthcare business? Very simple. It's a few simple data. Which IC services are being delivered, in which healthcare system, the healthcare provider, to whom, the beneficiary, and why, the diagnostic. These are codes. So the transaction or the information that we must collect to run effectively the population health is a simple set of codes. And this information informs the transactional database. So the National Health System entities relationship is the following. You have the National Health Service Administration, we have the health providers here, and we have the beneficiaries. The relationship between the National Health Services and the beneficiaries is a health plan. The health plan is the basket of services that a beneficiary is entitled to obtain from the health administration. The relationship between the health administration and the providers is a contract. So there should be a contract that defines what services each healthcare provider is able to provide and at what cost. And the relationship between beneficiary and providers is the online transaction validation. I would say online because it's the only way that we could audit and transactions or the services could be properly registered. And this is in every segment of any industry, and you know, the health system is an industry. So I think, are you saying that I have to shorten my presentation, right? All right, let's go quickly. Well, this is the eHealth solution, online transaction validation, where the beneficiary with the health system, and we have each encounter becomes a transaction. And could you, I would give you, the moderator, could you tell me how much time I have left?
About 3 minutes, please. Thank you very much.
Okay, this is a transaction validation process, and where the healthcare provider encounter picks up information from the beneficiary ID, the healthcare provider ID, diagnostic, and the service code. It goes through a validation process. It will meet the business rules, and if the transaction is validated, you know, they have an authorization process. So the transaction will be rejected if it doesn't meet the business rules. It might be pending of authorization if that particular transaction requires a prior authorization from an auditor or controller. And in that case, the transaction could be awaiting, or simply the transaction meets the business rules and it's automatically authorized. And this is another set of processes that the healthcare administrations could manage. And With the eHealth transactional information, we can evaluate quality of services with world standards and sound medical protocols, know the cost of services, which is very important. We can decide what and how these services could be financed, and we can assign human and technical resources where needed, and we can populate health statistics databases. Now, this transactional system has been very efficiently implemented in some countries, in particular my country, Argentina, which has a very, it's a very particular administration, because the health system is decentralized in regions, so each region is autonomous and it does its own. So the central ministry was absolutely unable to set up any guidelines or rules, but about 6 million people involved in public and private health systems are being managed through a transactional system that is very efficient, and this is an experience that could be easily translated into any other country, because the technology involved is simply a switcher that takes care of the transactions, and in the end of the healthcare provider, the requirements are very small. The requirements is a very simple interface, or could be a computer, could be a point of sales terminal, could be a voice response system to a telephone. Simply what at the provider's end, the codes have to be obtained of the IDs of the beneficiary, the ID of the doctor, the ID of the services to be performed, and the code ID of the diagnosis. And with these 4 or 5 elements of data, the full understanding of what's going on is being played. So, a proposal basically is that the outsourcing of the eHealth services have to be the outsource of ICT operation until local capacity is built. Each country should procure IT equipment, should recruit specialized staff, facilitate the connectivity between administration, and promote adoption of health standards, basically for services, procedures, and drugs. I would say that ICD-10 diagnosis code is very worldwide operated, and so what we need to standardize at this point is services, procedures, and drugs, and build the technical capacity of managers, health insurance administrators, health plan engineers, hospital administrators, cost specialists, statistics specialists, and in particular medical coders and transcriptionists. So I will end my presentation here, and thank you. And if there's any other questions, I'm very glad to respond. So I will give you back
Thank you so much, Dr. Sandor, for a comprehensive presentation. I really think it encouraged us to think about how to public e-health, how to policy and implementation in the context of healthcare as a business that must be, as your slide said, properly run with ICT tools in an e-health platform. So thank you so much, and thanks for those proposals, which are really valuable, about outsourcing. In the meantime, outsourcing e-health services, building technical services, and so forth. At this time, I'd like to open up the floor to questions. You can either use the hand symbol below your name, that small box with a hand in it. If you click it, it allows you to raise your hand, or you can post a question in the chat. So we are now ready to take any questions that you may have. Are there any questions for either of the presenters this morning? In the meantime, I will ask a question while you formulate. I wanted to ask Mr. Doane, who do you think would be ideal champions for change? I noticed that one of your slides mentioned this as a way forward, one of the strategies that we can use for policy and implementation. Who do you think would be ideal for the region in terms of champions for change? Afterward, we'll take Dr. Faber's question.
Thanks. That's a very good question. I think one of the important things when we think about the champions and leaders is I think they should not come specifically from IT. In many cases, we're still the situation where anyone who thinks, or decision makers believe that anything that connects to a computer needs to be in the hands or should be under the leadership of IT. I think what we really need is practitioners who have a really strong sense, certainly of IT, but understand the areas that they're working in and really understand how technology can enable or transform that. So I really hope that we can begin to build practitioners. In fact, I see it now. I see in many countries people who either have formal health informatics training or are highly passionate about the role of health informatics in terms of transforming public health practice or clinical practice. And I think it's really those folks that need to raise their voice and become the spokespeople for the vision of eHealth in the country and the region.
Thank you, Mr. Doane. I'll let Dr. Faber speak now.
Okay, I have two questions. First to Mr. Sloan, thank you very much for the two presenters. They're really very good information you have shared with us, and it's interesting because you make us think a little more about which challenges we have in the region for ICT's development. My first question, Mr. Sloan, is about this conception of sub-regional strategies, especially related to information systems. I would like very much if you can expand a little more. Why are you thinking that it's more available sub-regional strategies more than a regional one, in terms that we are looking forward for global health concept, and would be important also to have this conception. So I would like very much if you can expand a little bit about that. And my second question is to our second presenter. I liked very much this conception that you present to us in relation to how healthcare must be absolutely related to ICTs as a resource and in a very, I think, competitive conception. But here we have a problem in the region, and I would like to set up the question in this sense that what we can do to strengthen a little bit more the presence of ICTs, especially information systems also, in the political programs, in the policy, in the public policies statements, in the sense that here in Mexico, for example, we are in this moment beginning with a new government, and 1 month ago was presented the national program, development program, and the national healthcare program. In the both of them, we don't have any mention about ICTs as a resource of healthcare improvement. It's absolutely absent, and everybody knows about the visible contribution that ICTs has. But in policy, we don't have any mention about health information system improvement, nor ICT's use for healthcare. What do you think about that? I would like very much your opinion.
it's okay, I'll jump in with the first question and I'll let Tomas take the second question. As I understand, the question is why, or what's the interest or what's the benefit from focusing on a sub-region, just a regional level, given the kind of global context that we're working in. I certainly believe that obviously working at a regional level, and by region I certainly mean the entire Latin American Caribbean region, is important. And the more that we can work at that level in the region collaboratively and share resources, I think we actually strengthen capacity at the national level. But I also think there's a lot of challenges at working at that scale. I think even from my experience, even with the Caribbean region, working and collaboratively and trying to get people together, trying to get a shared vision, trying to align the priorities and the stages of different countries is extremely challenging. So I think there's at least a role, if we cannot grasp on it that fully at that regional level, to begin to divide into sub-regions, and as I said, even sub-regions. So by that I mean, for instance, the OECS is a good example of a forum that already exists and that has a lot of commonalities and a lot of mechanisms that we can use to build on collaborative work. So from my perspective, certainly as much as we can work across the region, the better. But I would certainly take and see perhaps a little more opportunity in the short term for working in smaller groups, affinity groups that are closer together geographically, closer together in terms of health system context, and need in order to begin to facilitate, the resource sharing, collaboration, and those kinds of areas, whatever way we can actually achieve.
Thank you, Mr. Doane. Dr. Sandor, your responses? Dr. Sandor, are you there? Okay, in the meantime, while I'm not hearing Dr. Sandor, I'm going to ask a question that has been posted in the chat by R. The question is, the web-based ICT is a great idea. However, some remote communities in Panama do not have internet access yet. Any policy recommendations to establish these systems?
I can try and answer that if Tomas, I think that more speaks to Tomas's presentation, but I can speak to that maybe a little bit, and if Tomas is still here, he can certainly jump in and add or counter what I have to say. Certainly, I think connectivity and access has greatly improved over the last 10 years within the region and sub-region, but definitely there are certainly areas that continue to suffer from a lack of connectivity. I think there are a couple of ways that we can look at that, certainly from a policy perspective, and I think the last comment about the status and the lack of reflection of ICT in the national health policy and strategy in Mexico, I think, speaks to that. I think we really have to make sure that our decision makers in health understand, again, the value of eHealth and therefore the investments required in eHealth, and actually begin to build policies related to equity in terms of access. So again, we've spoken for many, many years, and we understand and we have many strong frameworks about the access of equity in health. And certainly, I think the access to technology is going to be part of that equity equation. So from a policy perspective, we need to continue to educate and advocate with our decision makers for understanding what those investments are required, so that, in fact, these types of connectivity and services are available anywhere. Again, I think there are technological opportunities that we now have that were maybe not present. Certainly, networks are becoming more ubiquitous, and certainly mobile technology in many countries, even in remote areas, have a fairly robust mobile infrastructure. I know from some of the work I've just been doing in Guatemala, the government is working there with an NGO in some of the remote areas to test out a SMS-based and digital web-based set of tools that are helping workers in the field to facilitate the collection and delivery of health services through ICT. So there's a technological component to that as well as a policy component. But again, I think, until we make sure that ICT is fully integrated into strategic health system strengthening plans, we are going to see inequity that's caused by lack of availability in some of these ICT resources.
Thank you, Mr. Doane. I'd like to find out if Dr. Sandor has any comments, if he can speak at this time.
Yes, I missed a little bit the questions from the lady from Mexico, so I'm sorry about that. I had a phone call. So let me know if what are the questions that you would like me to respond. Hello?
Sorry, do you want me to repeat the questions? Okay, thank you, Dr. Sandor. What I was sharing here in the audience was that I am really very concerned about the way that policies, healthcare policies in our countries are absolutely missing the use of ICTs and the improvement of information systems for healthcare planning. I was giving the example in Mexico, we have a huge development of ICTs in many levels, but when we talk about policy making, when we need some support from the government in the sense of use, especially for vulnerable groups, ICTs, in order to reduce cost or try to close to the attention, the healthcare attention to this group, for these groups, in the policies, in the national policies, nor even in the policies that the states are implementing today, there's no mention about how we can now use ICTs, what granting we have to expand the ICT use in different groups, nor in the information system. For example, we have really very, our information system are in some sense not well integrated. The indicators are not the best for using for healthcare planning. So what I was asking was what we can do in the policy terms to try to include these issues that are so important in the policy making.
Okay. I think one thing we could do is follow Colombia. For example, Colombia had a very interesting development in policies on terms of ICT, and Brazil too, and Uruguay also. And so there are some countries that they're doing a good job in terms of defining policy. The problem in general is that Ministry of Health are run by doctors, and doctors really don't know much about IT, and sometimes they don't even believe my IT. So there's always, I would say, we will find a lack of development in terms of policy, because basically what IT does is transparent the market and bring information to the central administration. So I've seen in many countries where sometimes the local healthcare providers react against policies because they get involved with some little misdoings, and sometimes they react against policies. There are other countries where also the international funds like the IDB, the International Development Bank, they don't really press too much into the national administrations. So policies must be centralized, and that databases have to be unified, and sometimes by loaning money to different programs, what they support is the fragmentation of the information systems. So if you look at Latin America now, we will see a number of databases which are probably, sometimes they refer to the same population target, but those databases don't talk to each other. So there's no policies about, interoperability. We need policies about, standardization. And some of our governments are very slow, really, in understanding those needs. So I'll give you back the phone.
Thank you, Dr. Sandor. I think those are excellent comments coming from both you and Mr. Doane, and I think it really reiterates a lot of the ideals of the ESAC project and, things that we have been discussing, how to influence decision makers, how to bring ICT and concepts of equity and social determinants of health more to the forefront in public health and public health systems. I would like to thank you both for your excellent presentations this morning. Unfortunately, we were not able to be joined by Professor Mendez-Davidson because today is his birthday and his family has taken away his laptop and said he is a workaholic. So unfortunately, we were not able to have him this morning. We will have him again another time, but we really appreciate both presentations that we have had this morning and thankfully had more time to get deeper into those presentations. And we will, as I said before, we will be posting the recording on the ESAC YouTube page by tomorrow. So those that were a bit late to the session today will be